Hi, I'm going to try to explain what COPD is. C stands for chronic, which is long standing. Obstructive means the bronchial tubes are partially obstructed or blocked because of secretions, because of spasm of the muscles. Pulmonary, P, means lungs, and disease means sickness. That's what COPD means. It usually includes chronic bronchitis, which is inflammation in the bronchial lining, secretions, thick, sticky, and emphysema. Emphysema is destruction of air sacs which transfer oxygen from the air into the bloodstream. Emphysema is non-reversible, irreversible. Once you have emphysema, it's impossible to get that lung tissue back, unfortunately. Most patients have a combination of chronic bronchitis and emphysema. So if your family doc said you have asthmatic bronchitis or chronic bronchitis and one of the chest x-ray shows it's emphysema, please don't get confused because the treatment is same. Most cases of COPD occur because of smoking. It can also occur because of secondhand smoke as a child if your parents smoke around you, repeated infections, working in air polluted environment, or family history of emphysema or chronic bronchitis would predispose you to COPD. It would cause cough, shortness of breath, thick, sticky secretions, repeated infections, unfortunately. And when you do get infections, they would require longer time on antibiotics, may even cause you to end up in the hospital. You can slow down the rate of decline by smoking cessation, taking good care of your bronchial tubes when you have infections, getting on the antibiotics as soon as you can, doing exercise program, watching your nutrition, and similar thing. Oxygen, if your oxygen level is less than 89%, then you would benefit from using oxygen 24 hours a day. I know nobody likes to wear it, nobody likes to use it, but that has been shown to improve quality of life and survival in patients with COPD who do have low oxygen. Pneumonia vaccine every 5 years is must. It gives you protection from a commonest bug causing pneumonia. Not all the bugs, but commonest one causing pneumonia. Flu vaccine every season is also important. Taking your medications. There are several kinds of medications. The nebulizer medications are for moderate and severe COPDers. And that's usually a liquid that you put in a machine called a nebulizer machine. You put that liquid in that machine and that machine makes mist out of it. And you smoke that mist, inhale that mist 3-4 times a day. This is what it looks like. There are some patients who benefit from long-acting medication like Spiriva. This is what it looks like. And it's a capsule that you put in this inhaler and take it only once a day. That has been shown to improve, this is what it looks like, improve lung capacity by 30%. It's called Spiriva, S-P-I-R-I-V-A. So you take the capsule and stick it in here, snap this thing close, and puncture the capsule by pushing twice, and then hold and breathe out. And when you are done, take the capsule off, throw that away. That is important. The other medication that we use is called Advair. which is 1 puff twice a day, and that has 2 medications. 1 takes care of the inflammation in the bronchial tubes, and 2 opens up the spasm of the muscles. This is how we do it. You open it, click it, put in your mouth and take deep breath, hold, 1 puff twice a day. The other medication called rescue medications goes by Proventil, Ventolin, and that's when you are away from your home, short of breath, cough, shake it in your mouth, squeeze, slow deep breath, out, 2 puffs 3-4 times a day as needed. So these are some of the medications. Patients ask me a lot of the times about rehab. It's an exercise program which has been shown in large studies to improve lung capacity, reduce exacerbations, reduce hospital admissions, and it's at the hospital. 2-3 times a week for several months you go to the hospital and do a supervised exercise program. It's called pulmonary rehab. So that can help. Oxygen can help. Those medications can help. Smoking cessation can help. If you keep on smoking, you are damaging your lungs, and it's going to destroy your lungs and kill you, unfortunately. I know it's tough, but the benefits would to you. You will be the beneficiary if you stop smoking. Most of my patients who have stopped smoking have done it so with the help of their family, willpower, nicotine gum, nicotine patch, Chantix, Chantix. So please make up your mind, stop smoking, ask for help, and we'll provide you help. Nutrition. If you are overweight, it's going to push on your lungs and make you more short of breath. If you are cachectic, you lose muscle mass, and that's not going to help you as well. Salt restriction helps, especially when you have swollen ankles. With COPD, the lungs become stiff, and that causes the fluid to back up in your ankles. To cut back on the salt, restrict the salt intake, that helps. If you have environmental allergies, the mold, dust mite, dog, cat, all those things can make your cough, congestion, shortness of breath worse. So try to keep a clean environment, and we have some resources that we can give you on how to achieve that. I talked briefly about smoking cessation. The way you can do that: 5 days before your quit day, tell your friends and family that you are quitting, stop buying cigarettes, throw the lighters away, even from the car. 4 days before, come up with other things that you can hold in your fingers. Think of habits that require change. 3 days before, plan on how to spend money you'll be saving when you stop buying the cigarettes. Think who you can call for support. 2 days before, buy a nicotine patch or nicotine gum. 1 day before, put away the lighters, ashtrays, cigarettes, matches. Clean your clothes to get rid of the smoking, the smell of the smoke. Quit day, keep busy, keep on working. Tell your friends and family that this is your quit day. Reward yourself. Keep on it. The pain gets less and less as time goes by. So do all those things. Follow healthy diet, eat plenty of fruits, vegetables, and protein in your diets. Pace yourself. Take frequent breaks when you become short of breath. Use nebulizer or the inhaler 30 minutes before sexual activity. Use oxygen during sexual activity. Tell your partners to take more active role. Travel with oxygen, travel with nebulizer treatment, travel with antibiotics and prednisone if you need. So do all those things and maximize life. I know it's difficult, but if you do the right things, you can live with COPD and you can maximize life. Thank you and good luck.